First of all, as way of introduction, I'm here today with Edel Carey, who is our registered advanced nurse practitioner in older and adult care, with a specialist focus on dementia delirium and NCSD, with the Féileacáin Bán service in Cherry Orchard Hospital and Community Healthcare Area of Dublin South, Kildare, and West Wicklow. Edel, very nice to talk to you and catch up again. How are you keeping?
I'm good, Sean. Lovely to be here. Thanks.
We're delighted to have you as well. So, Edel, what we're doing as part of Public Sector Transformation Week is really highlighting some of the great innovation that's on the ground and that has been supported through Spark. Obviously, yourself have undertaken a very substantial innovative project. So I guess what we'll start with is just talking a little bit about that project itself, if you don't mind, and Féileacáin Bán.
Yeah, so Féileacáin Bán is a nursing service model of care and support that is made up of pathways to support people living with dementia and their family care partners, and to bring care closer to home.
Perfect. And tell me, what inspired this idea? Where did this come out of? What was born of it?
I started my advanced practice journey, and my main aim was to develop a pathway, as is what you do with advanced practice. And as I got out into the landscape of the community, I began meeting people living with dementia and their family care partners. And I listened carefully to what their needs were and thought, well, there's lots of interventions that could be incorporated into these pathways. So with co-design, I would have worked each pathway, and as one was developed, I moved on to the next, and that's how I ended up with a service called Féileacáin Bán.
Great stuff. And I think we can, I suppose, guess somewhat who benefits, but why don't you tell us who benefits the most from the services?
Well, I would say everyone benefits. The patient themselves benefits, and their family care partner, because they get to remain at home in the community. I would say all the acute hospitals benefit, as I do my damnedest to avoid hospital for people that I'm looking after. And I would also support early supportive discharge from the acute setting. And then the Exchequer would benefit because of cost savings. So they would be multiple, that I am seeing a patient in a community clinic as opposed to a hospital clinic. So there's huge cost saving there as well.
I particularly love about these types of services and innovations is obviously that we're into the community, and it's a focus on not just the later stages of dementia, but the earlier stages too, and that feeling of community link-in and support, which is really important. But when you're undertaking an innovation like that or a service like that, I imagine you must have had a number of challenges that you had to face. So would you mind highlighting some of the biggest challenges or hurdles you had to overcome?
For me, my background was residential. So when I moved into advanced practice, I was now accessing a landscape that I hadn't worked in before, which was the community. So that came with its challenges, and trying to develop a network, because obviously I needed pathway partnerships to develop the pathway that that I was working on. So that was very challenging, and creating that network, getting it out there who I was. I had no predecessor, so I had nobody to call on to get advice on that. And I was accessing a range of different services, not just HSE services. It was GPs, pharmacies, voluntary and community services. And then I think when I had the first pathway ready to launch, I then had no premises. So that was a massive challenge. So I had to go around to, I suppose, who I had networked with to try and access office space, which I successfully did, and launched my first pathway in a health centre. So there was many challenges, but it was always about, many closed doors as well. So it was always about coming back with your original plan and redeveloping that and presenting yourself again.
Yeah, and I think I think the service itself and the work you've done is brilliant. And I think inspiring for other would-be innovators too, in just understanding and realizing that I mean, as you said yourself, you didn't even have a premises really to start out of this, and you had no one necessarily leading out ahead of you that, you know, was able to give that bit of guidance or anything. So this was really on your own back, but achievable, you know, which I think is a testament to yourself, but I think it should serve as encouragement for others as well. Anyone who has ideas, to just keep in mind that they are very much so achievable and doable. Edel, thanks very, very much for the chat today, and hopefully looking forward to seeing you soon.
Lovely to be here. Thanks, Sean.